Hello, HyddenWell farmers. It's good to see everybody. I have the lovely Miss Popo.
Good girl. I love you too.
And Miss Sue. She's here with me tonight. And I'm going to quiz Miss Susan this evening and see just how much that she has learned over the years.
Oh boy.
We had an incident that happened in the clinic, and I think about it and I get tickled. I had a client that came in, and Susan was helping me hold the cat. And as I lifted up the tail and looked at the bottom of it, I said, "Oh gosh, there's a lot of excoriation around the volar area." And the owner, the client, goes, "Boy, that's a really big word." "What does that mean?" And Susan goes,
She's raw.
"She's raw." So I have been involved with veterinary medicine for 27 years now. Nearly, longer than Susan and I have been married, so I guess 28 years now. But I grew up in the medical profession, so to speak, because my mom was a nurse and my grandpa was a medic in the military. So, I don't know, I've just always been engrossed and amazed and full of medicine all my life. And so, my wife has been with me 99.9% of that journey because we got married my sophomore year, between my freshman and sophomore year of veterinary school, all the way back in 1993. But anyway, I thought that maybe, since she has helped me run a veterinary practice and stuff for all of these years,
I'm afraid.
that I might ask her some veterinary terms, medical terms, and see what she knows, see what she thinks they know. Are you ready?
Sure.
For this quiz?
I'm afraid.
All right, the very first one, I got a cardboard thing so she can't see. The very first one is an easy one, excoriation. Miss Susan, you've already told us, but go ahead. What is excoriation?
Well, it's basically just being raw, like the outer layers of whatever epidermis you got there are all ripped off.
That's excoriation. Excoriation is kind of like a chemical burn, but it's a burn that's caused by infection from the body. So it's the extra layers of the skin are inflamed and they burn and they hurt, and so we use that term excoriation. And road rash would be a form of excoriation.
No, thank you.
I can't remember the last time I had road rash because I'm so old now that I haven't ridden a bike in, 50 years? But anyway.
I have fence rash.
Fence rash. Yeah, that's true. She got bowled over by a sheep the other night.
No, I caught that sheep.
You got bowled over.
No, that sheep just dragged my arm.
That sheep may not have got away, but you got bowled over.
Oh, okay. She just
dropped my
slid
pen.
in. That's not my fault. What do you need a pen for? Are you
I don't
writing down
know.
the answers?
No, I just want to look important.
Oh.
All right.
Okay.
Term number 2, entropion.
That's an eyeball thing. It's like an infected eyeball.
No.
No?
No.
No. Is it?
Entropion.
It's got to do with the eye, right?
Yes.
Is it?
Entropion. 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 I love that word.
It's not an infection. Is it like where the third eyelid's sticking out or something?
No,
I don't know.
that would be a third eyelid sticking out.
There's no technical term for that one.
You're pretty close. Entropion that would be a prolapse of the third eyelid, but entropion is where either the upper or the lower eyelid is actually rolling in on the cat or the dog, and the hairs of the eye are rubbing on the cornea.
I feel like that would cause an infection.
Yeah, it would cause eventually, but it's extremely uncomfortable. Some dogs are born with that. Some cats are born with that. Some horses are born with that. You have to make a little cosmetic surgical correction of that to roll that eyelid back out in its normal position. Okay, so that
Surgical.
is a X
No,
on that
no,
one.
no. That's a half a point.
What?
I knew it was eyeball.
Okay, half a point.
Thank you.
Back in kindergarten.
Yes,
half
we
a
are.
Give you a half a point.
Hey, if I get 2 half points, that's a whole one.
All right, an easy one.
That's just math.
Encephalitis.
Swelling of the brain?
Swelling of the brain. Ding, 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 ding. Yes, encephalitis.
Most often seen in chihuahuas.
I have suffered.
And puppies.
And Keaton.
You have encephalitis?
Yes, every time you slap me upside the head, I've had
Mighty Joe
encephalitis.
had encephalitis, right?
Mighty Joe did have encephalitis. Parvo-induced viral encephalitis. Yes, he did.
Do you want to leave?
Swelling. All right.
You don't want to leave?
Another one of my favorite terms to use. Auricular hematoma.
That's a ear boo-boo.
It is an ear boo-boo.
Where they usually, because they shake their head and they make, it's like a blood, they explode the blood vessels
Yeah,
in their
the
ear.
ears, the cartilage and the skin separate and it fills up with blood. Also known as an oral, A-U,
R-A-L.
yeah, A-U-R-A-L, oral hematoma. But I growed up saying auricular hematoma, and now it's oral hematoma. So
Well, that sounds like
I
it's
think
like the
they're,
mouth.
I think they're interchangeable.
I wouldn't
but yeah.
say oral because that just sounds wrong, like the wrong
Well,
letter.
yeah, but see, we're from Kentucky, and I'm sure it's got some other stress on the consonants, like oral or something instead of oral.
You pronounce Mary Murray around here, so you can't say oral and mean...
I'll stick with its auricular hematoma.
Yes, yeah. All
right, you get an A+ on that one.
Like I've been flapping my tongue around. So
If I said the word scleral injection, what would I be talking about?
stabbing something in your eyeball.
You know, now that I think about it, if you got an injection in your sclera, that could constitute a scleral injection.
That's right.
However, when we look at the sclera of an eyeball and we see this, we usually say it's scleral injection.
Okay, that I don't know. It's like glaucoma. I don't know.
It's where the eye is so irritated that all of the blood vessels have popped out, you know, and it looks like one of those Halloween eyeballs, you know, with the, you know, and all the little blood vessels and stuff running down.
Okay.
Do you have scleral injection?
I have no sclera.
No, I'm sorry.
Leave me alone.
All right.
Right?
Half a point.
No sclera. Hey, I would have been right if you'd been stabbing it in the eyeball.
You know, you don't get a reward for this. Why are you fighting so hard?
I like points.
Okay. Full point.
Thank you. Thank you very much.
1 point. All right. Alopecia.
Okay, that's a skin thing, right?
It is a skin thing.
It's kind of like psoriasis
No.
and stuff, but it's caused by allergies?
No.
No?
No.
Is it an infection of this?
Allergies could be a cause of alopecia, but what does alopecia mean? What is that?
It's like... It's not just raw, because that would just be raw. But it's like bumpy and... Is it itchy too? I don't know. You diagnose it, but I never actually see it.
Yes, you do. Alopecia means hair loss.
Is that it?
Balding. Yeah, that's it.
Oh, okay.
You can have infectious alopecia, or you can have inflammatory alopecia. You can have alopecia where the dog just is bald in a spot.
So it's not the skin; it's the hair.
It's the hair falling out.
So
It's balding.
You can't give me a check mark. That was a 0.
Oh, sorry.
Because it wasn't actually the skin's fault. It was the hair loss. It's hair. I would have been right if I'd said follicle, a follicular problem.
Well, that's true. Crepitus.
No idea. What is that word?
What? You don't know what
Crepitus?
crepitus
Sounds
is?
like phlebitis.
You can't steal my words. No foreshadowing in this.
Crepitus?
Crepitus.
Crepitus.
Yes.
Well, let me guess. Hold on. Crepe. Like, I don't know. What's a crepe?
Crepitus is when you have air under the skin.
Oh.
And when you push on it, it feels like little popcorn bubbles underneath the skin.
Yeah, I've seen that.
That's-
like after a car
wreck. I'll tell you where we used to see it a lot is in blacklegging cattle. You'd go out there and you'd push on their leg in an exam and you'd feel all these bubbles underneath the skin. Oh, it's got blackleg. It's got crepitus.
Do you need some crepitus?
But yeah, if you like puncture a lung and you start pumping little air bubbles underneath your skin, you'll get crepitus. What do you do for that? What do you do for crepitus?
You let it go away on its own.
That's exactly right. You get a bonus point.
Oh, cool.
+1. Yeah.
Well,
Very good.
how can I get a bonus point when I didn't even get the question right?
I don't know.
Oh, okay.
Because you said you let it get along. So, you may not know what the word meant, but you know how to treat it. That's.
Well, the weird thing is I was thinking of crepey skin, so I almost said a skin thing, but everything's been skin stuffish almost.
Phlebitis.
Lots and lots of flea bites.
Good dad joke. Whoop, whoop, whoop.
Except
Okay, stop now.
I would assume it started with an F, not a PH. No?
Phlebotomy. Starts with a P.
No. What's that got to do? Because it steals your blood?
What's a phlebitis?
I don't know. I always
Inflammation of a vein.
it's
Like if you have a
flea
catheter or something
so
in your vein.
you were making a real word.
Yeah, phlebitis, not phlebitis. Phlebitis. Phlebitis is dangerous in people, really dangerous, because you can get blood clots and throw. And it is dangerous in dogs and cats. You have to be very careful because you can get,
Sorry, Popo's sliding off the chair.
because you can get, compromised blood circulation and blood clots and all that kind of stuff, and you can get severe infections. But I will say, all in all, they deal with phlebitis a lot better than humans do.
Popo
Yep.
lost 1.5 pounds.
She's a good dog.
She's still fat.
You have to call that dog fat.
Fat. She's fat.
She's PHAT fat.
Well, she's awfully cute, but she's still way fat. You're my fat girl. I love you. I love my fat girl.
All right. Episoplasty.
Ew. Okay.
Ew.
Well, it makes me think of an episiotomy, and I don't want that. Episoplasty, that would be like sewing something together that came apart, that is not in a good place and sounds really painful.
An episoplasty is where we take the fat and excess skin around the vaginal area of a dog because they are peeing on themselves all the time. And so you have to remove that. And I've done a lot of those and really helped a lot of dogs. I mean, it's just amazing how much better they do post-operatively when they're not peeing on themselves every day.
Peeing on yourself is bad.
It's bad.
It still sounds
especially
like
in a
awfully
dog.
painful surgery.
They get a lot of excoriation.
Oh dear.
All right, ready? Aortic stenosis.
That would be a heart problem, and that would be... Is that a heart murmur?
No, that would not be a heart murmur, but it could cause a heart murmur. What is aortic stenosis?
Heart enlarged? I don't know.
It can cause heart enlargement, yes.
Something bad to do with the heart that you don't want.
Well, what is the aorta?
It's your heart is part of your heart. There's like two ventricles.
It's the big giant
muscle. It's the vein. No,
artery.
It's the artery
That comes off of the heart.
Yeah, but
And it makes a big curve and goes down and feeds the rest of your body with blood. So what would stenosis be? It's hardening.
All I can think of is stenotic nares and.
Yeah, very much. A narrowing, or it's not able to open up. It's fixed in place. The aorta is supposed to contract and to help you move blood. It's almost as important as your heart in helping move blood. And when it becomes fixed and it becomes thick and it won't move, your heart has to work like 4 times as hard to get blood past it to the rest of your body.
Is that an old heart problem?
Yes, but now there's genetic, boxers have it genetically in their bloodlines, and some boxers are just born with it. And if you catch it like within the first few months of it calcifying, you could put them on medications that will extend their life.
Like what?
For a couple of years, like benazepril or any type of ACE inhibitor.
Does it reverse it, or it just keeps it?
Just slows it down. But unfortunately, they'll die young. Yeah, they don't make it very long. Yeah. Furunculosis.
Ew, pimple popping stuff.
Yeah.
Bleh.
But what is a furunculosis?
Big old infection in your skin.
It is. It is.
Makes like a big old
It's
boil.
it's a deep boil. That's exactly right. Instead of being superficial, it actually goes below and even gets part of the subcutaneous tissue, and it's all infected. It's not just a skin pimple, but it's like a deep subbasement membrane, nasty, painful, stopped
Where
up
are
infection.
all the fun medical terms? These are all gross.
Hyperadrenocorticism.
Is that Addison's disease?
That would be
Cushing's?
hypoadrenocorticism.
Cushing's? I don't know. There's
Hyperadrenocorticism would be Cushing's disease.
so
Exactly right.
this is Cushing's. Is that what you
Yes.
said? Okay.
So what is hyperadrenocorticism?
Cushing's disease. It's bad. It makes your skin fall out. I mean, your hair fall out. Ew, if your skin fell out, that'd be really bad. Right? Don't
It
both
would
of
be
those
bad.
make a hair loss
It-
problem when usually in older dogs and you have to do blood work? That's all I know.
Well, it's where the adrenal glands are producing too
They
much cortisol.
Smell gross.
Hyperadrenal corticism. The adrenal glands are overproducing cortisol.
Why does that smell bad?
Well, I don't know what you're talking about.
The dogs, they smell bad. when
Oh,
they have-
well, it's because they have a lot of times yeast overgrowths, and they have horrible thyroid problems, and they get secondary diabetes, and they're just very unhealthy.
So how do you tell Cushing's from Addison's?
The exact same test. You have to run either a low dose dexamethasone test or an ACTH stem test, and then most of the time you have to run both. But the difference between hyperadrenocorticism is that they have all of these clinical signs, such as drinking too much water, eating too much, their hair falls out, pot belly, cantankerous skin. Just terrible. Some of them I've even seen get so much muscle weakness they couldn't even walk anymore. They just felt so bad. You start treating and most of those things go away. Now, with hypoadrenocorticism, with Addison's disease, it is a metabolic dysfunction. They can go into a sodium potassium crisis and get that way out of whack, and they can actually die. You can have some really horrible Addison cases, but they're just lethargic. They don't want to eat. Their heart's all messed up because you have to have it to live. But if you get too much of it, you die too. So I mean, it's the complete lack of is easier to treat, but it's just as serious.
But the Cushing's is the one where their fur falls out and they smell awful. The Addison's isn't much like that.
That's correct. Yes. So last night we worked a whole bunch of sheep there at the farm. We were trimming feet. We were putting in tags, and we were doing all these just maintenance stuff on our sheep and our flock. And Susan was taking notes and all that kind of stuff. And one of our sheep, what was its name?
What are we talking about?
Got around the back of the thing, and Susan decided she would catch it. So she reached down to tackle it, and the thing bowled her over, but she got it stopped.
Oh, that wasn't last night. It was Bedlam.
Was that Bedlam?
I think it was Bedlam when we were doing the other set of sheep. Because look, it's already scabbed. And no, I didn't get hurt last night.
You didn't help me, and
It was when we were loading them on the trailer.
when we were loading them on the trailer.
Yeah.
That's right.
Bedlam went, didn't she?
She did go. That's
Yeah.
right. when we were loading them on trailer on that
She
Sunday
was running away
afternoon.
from the trailer, and we were all like this, and she was like, "I pick you."
That's
and
it.
She picked me, and
Yeah. So show them your boo boo.
we ran into the fence together, and she scraped my elbow down the fence. I had
She caught-
excoriation caused
But,
by a fence attack. Actually, I was just missing like 2 layers of skin.
Well, when Bedlam, we called her because she's never raised any babies and she doesn't make milk anymore, and she had a tumor in her udder. So we sent her to market, and I was looking at that piece of paper, and I think she weighed a little over 220 pounds.
She was a big girl.
She was a big
But
girl.
I stopped her.
Yeah, you did. You did a good job. All right. So for bonus, where's your Ole Cranen? I asked you that before. All right. Any last words for HyddenWell Farms?
Don't do that.
That's all.
That's it. I don't have anything good except cookies are delicious.
There.
Especially if somebody else bakes them for you.
That's right.
They're really good.
Bye bye.
Bye.